Welcome and step into the minds of addiction and recovery. Hello, I'm your host, Brett C. It is an honor to bring into light one of the darkest aspects of our society, addiction. With 20 years of active addiction and 20 years of sobriety, I hope to bring together all listeners on a journey of inspiration and education. With my co-hosts Jared F. and Rich J., we will be sharing our experience, strength, and hope for all listeners to enjoy and have fun with. Now, F3 Recovery brings you the Super Sober Podcast. Welcome to the 15th episode of the Super Sober Podcast. Thanks for joining in, all of our friends and family out there. We know it's been a while since episode 14. We are excited. We have a new sponsor going on, and that's His House New Creation, and out there in the Inland Empire here in Southern California.
At Embrace Life Change, your journey to mental wellness begins in a place where understanding meets action, where care is personalized and recovery is achievable. With over 30 years of experience, our expert team offers a range of evidence-based treatments tailored to each individual's needs. From anxiety and depression to complex psychiatric disorders, our comprehensive approach includes cognitive behavioral therapy, mindfulness practices, and innovative programs designed for deep healing. Our small treatment groups ensure personalized care, fostering stronger connections, and a supportive community that empowers your recovery journey. Hear from those who've embraced change and found hope, healing, and a path to a better life with us. Embrace Light Change is more than a treatment center. It is a place where lasting change begins. If you or someone you love is seeking help, call us first. Let's take that first step together towards a brighter future. Embrace Light Change, nurturing mental health, where hope and healing meet.
So we're excited to have our first commercial and our sponsorship going on, and we've been contracted to do another year of podcasts. We are working into second year. We've been working on more quality than quantity, and that only proves to be true. Here on episode 15, we have our second doctor on the Super Sober Podcast. It's going to be exciting. She's the Wired for Addiction program out on the East Coast, breaking down epigenetics, understanding what's going on internally from the external, how to understand this process. Stay with us. It's going to be unbelievable. Just wanted to start off with that. I'm your host. My name is Brett C. My sobriety date is 4/21/03. I'm an RN with a BSN. I've been helping out in the mental health field for over 18 years, been working in substance abuse treatment. This is my 10th year of helping people understand this unbelievable, crazy, convoluted process, addiction. And I got my co-host here, Mike. He's been on different podcasts with us, joining in on an early Monday morning here on the 13th. Go ahead and introduce yourself, Mike.
Yes, my name is Mike D. I have a sobriety date of January 18th of 2020. Have a bachelor's degree in business administration, and currently just completed my registration to become a drug and alcohol technician, and will shortly be going to school to get my KDAC.
Here we go. More education and inspiration going on. I'm going to introduce our first guest with this whole platform that she's doing with the accolades process. I'm going to work on getting through this. It's quite extensive. So here I go. Dr. Evelyn Higgins is a chief executive officer and inventor of the patent pending panel utilized by Wired for Addiction. Dr. Evelyn Higgins is a recognized international expert in the field of addiction. With 34 years in clinical practice, Dr. Higgins has dedicated over 16 years to research and development in the science of addiction recovery. A panelist at the 2022 International Society of Substance Use Professionals Conference and a 2021 nominee for Modern Healthcare's Top 25 Innovators in Healthcare, Dr. Higgins finds herself at the nexus of epigenetics, neuroscience, and addiction. During her career as a doctor of physical and functional medicine, Dr. Higgins had the honor of advising the U.S. Surgeon General, being an Olympic torchbearer, as well as serving as a 1996 Olympic team doctor. The host of a nationally syndicated Gracie Award-winning radio program, Dr. Higgins has interviewed many prominent figures in politics and various affluent platforms. An author, speaker, clinician, Dr. Higgins is a graduate of the State University of New York. Her postgraduate studies at Harvard Medical School are in mind, body, and spirit medicine. She is a diplomat of the American College of Addictionology and Compulsive Disorders, a diplomat of the American Board of Disability, specializing in pain management, and a graduate of New York Chiropractic College, as well as a certified addiction professional. Without further ado, here she is, Dr. Higgins. Thank you for taking the time this morning to be with us and talk about your platform, epigenetics, and everything else that correlates, and a little bit of history of your story. Thank you very much.
Thank you. It's my pleasure to be here with you, gentlemen.
Awesome. So we're going to be getting into it. I think we should just go ahead and maybe show a quick little definition of epigenetics and a little quick video on that. What do you think, Dr. Higgins?
Let's roll with it.
Let's go with the video first, Solomon. And I wanted to just also say thanks to Solomon here at the podcast place in Long Beach and our producer, Solomon Daniels. Thank you, sir.
No problem. Let's get the video going here.
Let's do it.
Your DNA contains the thousands of genes that inform traits like eye color, height, and risk of disease. Though your DNA remains the same throughout life, your lifestyle can actually determine which genes turn on and which turn off. This is called epigenetics, and it has major implications for your health. So how does it work? The Greek prefix epi means above, as in above your genetics. If your DNA is like the script to a play, your epigenetics are like the director's notes, instructing some actors to shout and others to be quiet. The amazing news of epigenetics is that we can make lifestyle decisions that influence gene expression in ways that improve our health. For example, consuming whole food phytonutrients like B vitamins and folate from beans and whole grains can influence gene expression to help prevent diabetes and support heart health. Our DNA is not our destiny. With epigenetics, we're more in control of our health than ever before. Be sure to watch part 2 to learn about 2 processes for influencing epigenetics.
There's a little quick video to allude to what we're going to be talking about. And also the definition for epigenetics refers to the study of changes in gene activity that occur without altering the underlying DNA sequence. It's like a layer of instructions that sits on top of your genetic code and influences how genes are turned on and off. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence, which is super exciting, needs to be shouted out. I don't know how many years you've been shouting it out, but I have different mentors I've been following for the last 6 years. I don't know if you're a Bruce Lipton fan.
Sure.
He's completely helped me change my life with his other friends and his platforms and everybody going across the planet. Doctors like you, our previous doctor on episode 13 and 14, Dr. Alan Resch, with her platform, helping change the genetics of epigenetics of our who we are and how we express ourselves. And this being the Super Sober podcast, practicing the 12 steps and remaining accountable change, turning off the sympathetic nervous system, which is also would be turning off biomarkers also and suppressing them down, and then understanding our environment, and then having this unbelievable program in the 12 steps for us in the addiction world to rewire who we really are, and then like your platform, Wired for Addiction. So go ahead and just lead in and give us a little backstory and who you are and your platform. Let's go.
Sure. So great kind of teeing up to this conversation, Brett, because to me, epigenetics is the most exciting part of science of what's going on today, because it gives the power back to the individual.
Yeah.
What could be better than that, right? So my backstory, both personal and professional, practicing in the area of pain management, some 34 going on 35 years ago now, first in a rural area, seeing people not quite addicted, but becoming dependent. And then 20 years after, I am in an urban area, think, okay, things will be more progressive. Maybe we'll see things differently. No change. But I'm seeing at that time, people move from dependency to addiction,
Mm-hmm.
right? Personally, I married a man who was an alcoholic. A year after our daughter was born, we found out that he was adopted. I was already seeing behavior in him that was problematic. And now we have a child, knew nothing of his health history. This was a complete shock. Um, and all of a sudden, I'm like, what do I need to know to give my daughter her best life from what family history we have here? So all of that combined took me to where I am today and what I do. So we've been in research and development for almost 17 years now, what we do at Wired for Addiction. And as I moved along, I was realizing that, it's kind of the mental health aspect and the addiction aspect was kind of like, you guys are on your own. You got yourselves there. Good luck. Get yourself out, right? We weren't using technology to advance this part of healthcare. And it is health. Mental health is health.
Absolutely.
Behavioral health is health, right? But it was almost as, nah, you guys got yourself there, get yourself out. Still practicing like it's 1950 and not using technology to advance this part of healthcare. So that's where we really dug in and came up with what we do today at Wired for Addiction and Wired BioHealth. So we look at 85 different biomarkers related to mental health and addiction. Why mental health? Because that's where it all starts. An addiction is from a diagnosed condition not being treated properly, an undiagnosed condition, a trauma, 1, 2, all 3 of those. We have to look at what the mental health aspects are of that individual. Is it anxiety? Is it depression? Is it ADD, ADHD? Is it OCD? All of those things, because when someone starts with their addiction, every day I talk to people that say, whatever, let's use the example of alcohol. I started drinking. Well, one gentleman, he's like, the first drink I remember, I was 4 years old. I was with my dad at the beach. My dad said, hold on to my beer. I'm going into the water. He can remember 4 years old and how that tasted and how that made him feel, right? And then other people, I was 10, I was 12, I was 15, whatever the case may be. But it's whatever you find at the point in your life when you find it in that self-medicating that for the first time, you're like, whoa, this feels good. And initially it does. But then that becomes your next problem. Yeah. So we can't look at addiction without looking at the mental health and marry the two of those together.
Yeah, that is amazing. And I love the whole prospect of that. And that's not the only area of mental addiction and where we are as being medical professionals, understanding about shouting from the rooftops with like Nadine Burke and the ACEs test and so many different areas and different studies that show all of these different processes that it's like, here's the easily problem intervention evaluation. Let's go, let's rock. I didn't even know this existed on your platform. And I've been in the mental health deal for up to 18 years. And I've been working in addiction. I've been sober for practicing the program for 21 years. And then here this comes along. And then I'm at work talking with some other people, and they worked with a different doctor who was also doing this test and then applying it. But then I don't know what he's doing with it now anymore. So I'm sure glad you're doing it. And did you have any questions for her, Mike, on any of this stuff going on?
Well, just in previous episodes that I've watched Dr. Higgins, I was curious about some of the background regarding how we treated, you already mentioned it, like the 1950s, but how it was basically a verbal diagnosis, verbal testing.
Right. Great point, Mike. Because, you think about how people are diagnosed. Let's just use the example of anxiety or depression. How are you diagnosed? You go to your doctor, I'm really like wound up. I just can't bring it down. Or I just don't have my zest for life anymore. Here, take this.
Yes.
Right. That's how we're diagnosing people. guys, I think there's going to come a time in the near future where we see that as barbaric and start almost like, really? That was acceptable? That's how we diagnosed people? When there's nothing objective about it, it's totally subjective. So what if
Mhm.
my definition of the word isn't the same as yours? Do we arrive at the same diagnosis? Or if it's observation of a child by a teacher or a parent, do we arrive at that same diagnosis? Right? So that bringing that whole epigenetic portion into things, we're born with our DNA. Here's your cards, play them out, right? But we now know that we can change the expression
Right.
of that DNA. And that's the key. That's the key. I can tell you times that we've seen clients and patients, parent comes to us for 20 years old. I never saw this in my child. 21, all of a sudden they become a different person.
Mm.
Start asking questions. Well, what's gone on between 20, 21 in their life? Well, they went to college. They're on their own for the first time. They're doing their own laundry. They're trying to keep up with studies and have a part-time job. They have all new friends in their life. Their diet kind of sounds like it's horrible. They're not sleeping because parties are what's important. So this person's life has totally changed. Their environment has totally changed. Those genes were always there. We didn't see them play out the way they did because the environment was conducive. Now everything's uprooted. There is such power in somebody understanding how that works.
Yeah, that's super powerful. I mean, just understanding and going on a deeper dive in what's happening collaterally in your environment and let alone having the coping skills to even handle that. I mean, how many of our kids are dumped
Right,
into a college system, kind of nurtured or maybe not, because everybody's different. And I love the individual approach with it. And then coming
right,
back to the diagnosis thing, I mean, we got this conveyor belt process. I've been working
right,
in hospitals and working in with different psychiatrists and psychologists and addictionologists and doctors and all across the platform. And, it's okay. It's okay to not know what's going on. It's okay to maybe put Dr. House on the line and call him in and see if he can figure out the diagnosis, right? No, but it's like if we don't know everything, that's okay. But definitely
right,
going through the process and knowing what you understand, Dr. Higgins, and going with this. And it's like, how much pushback would be one of my questions when you go in and do your own diagnosing and have your own patient population? How much is it pushback from the other doctors that you converse with on reevaluating where they are with this, or even having their minds open to a lot
right,
of the different doctors? Because I see in working as a medical professional in the hospitals, it's like there's other ways to go about treating than what we're treating. And here
right.
you are offering it. And it's like, how much pushback do you get from your professionals on your side?
Great, great question, Brett. Really, the most pushback we've gotten from is from treatment centers, believe it or not, because
Mm.
they have the mill, right?
Yep.
Just kind of like the hospital system. They have the mill and they don't want to change any of that. And unfortunately, part of the business model
Mhm.
is that that person's going to wind up coming back at some point because their physiology is never changed. Now they're starting to embrace it more because
Amen.
the science is there and people are asking for it. I spoke with someone just before got on this with you
Mhm.
fellas, and mom told me. I said, "How did you hear about us?" She's on the West Coast. She's in Portland, Oregon. She called a facility in Florida and said what was going on with her son. And they said, "You really need to get to the root of the wiring of your son because it was a pretty severe case." And he said,
Wow.
"Call Wired for Addiction." So this is a treatment center so things are changing. Things are changing. People are saying we want this, but really from the everyone else in the field, from the criminal justice system loves us. We
Okay.
are in prisons. We are working. Our COO is the chairman of the board of the Florida Justice System and on the National Association of Criminal Defense Lawyers. They
Wow.
love us because we're making the job easier for the people that work within the prison system and for the individuals when they get out. Who wants
Mm.
to be going right back to that? We've got to change the physiology. 8 billion people in the world. with 8 billion different unique sets of DNA. We treat everybody exactly the same. Right. You guys are laughing because you're like, that makes no sense.
Oh,
Right.
Right. It
yeah.
makes no sense.
Gosh, that's such a breath of fresh air, and to get into it, to understand it, and to have a test done, it's hopefully with where you're going with it. This is a standard at birth process. Boom, here we
Right.
go. Here's your markers. Here we go, and then you could even follow up with it. It's super exciting. I know it's
Correct.
been implemented in different treatment centers around where I work
Yep.
and where we live, which is the recovery capital of the world, Orange County, California, here and in LA. So, I mean, that's why I really like that you're getting some momentum with this. And how long has Wired for Addiction been open?
So our business itself is into its third year, but like I said, we started in the research and development 16 years ago for
Okay.
what we do now. To your point, Brett, I'll share I did a TED talk about this, understanding the biomarkers of addiction. And in the TED talk, I make it around what if in your youth
Right.
you had this information? Would you make different choices? And in the perfect world, to me, that's exactly it, because we're going to go into life. We're going to have different experiences. We're going to find ourselves in different places. But shouldn't we have this knowledge? We still make our choices, but shouldn't we have this knowledge? Just like someone who has the BRCA gene for breast
Right.
cancer, shouldn't they know that? Right? It's no
Absolutely.
different. It's no different.
Yeah, we're testing for the trisomy 21 for Downs and
Right.
different things. Like I had a friend who unfortunately was going to have a baby. They found out it was going to have some genetic complications and they decided against having it
Hmm.
due to
Yeah,
the severity of the situations. And then
sure.
here we are. Let's go with the mental health. Let's put it all together. I mean,
Right.
it's super exciting. Kind of gives me chills talking about it. I mean, for us as the medical professionals on the front line, and it doesn't even have to be a medical professional. You can just go down the streets right here in neighborhoods and just watch what I would
Sure.
like to call the walking dead and
Sure.
so
Sure.
addicted in the high powered opiates and everything. And if we do the case history, which we do, on admission processes and Mike over here is going to be learning all that stuff, be working in treatment centers. And it's just like, wow, there's so much more solution. It just feels like the lost century as in how much absolute awesome technology that we have, but then how much is available, but what is not utilized also. So
Right.
getting the word out here, like how you're doing it, and then, I mean, who's more professional than you in this area? Could anybody really overcome and go, well, if you got a couple more degrees, Miss Evelyn, then maybe we'd put you in the conversation. It's like, whoa, we're talking the pinnacle right here. And I mean,
Well,
a lot
so
of our
thank-
friends and stuff like that too. I mean,
yeah.
that's in it. I mean, I'm a RN with a BSN. I mean, on this show, we've had 3 different nurses and people that are coming up through the trajectory of practicing the program, or people who used to live on the streets, like Anthony Brown on episode 11. I mean, he's starting on a whole new trajectory for the homeless out there. And then we can connect you with him and then also have that. And that's what we're doing on this side of the things. And so many other people in the community is just linking and syncing everybody up.
Which is beautiful, Brett, because the work that you guys are doing on your podcast is truly so necessary. Because when we have these open type of conversations and talk about what I call real talk, right? It
Yes.
removes the stigma, it removes the shame. I mean, addiction is not a moral
Oh,
flaw. It is not a moral flaw. If someone had diabetes, we wouldn't be like, why are you so weak? Why are you going around doing this? Right? But somehow in addictions, it's okay to treat people that way.
mm,
It's not okay. And you look at The Walking Dead, right? The Kaiser study that came out in 2023, post pandemic, talking about 53% of the population being diagnosed with anxiety and/or depression. Diagnosed. So we both know, all 3 of us know, right?
mhm.
That if that's diagnosed, we're talking about including undiagnosed, we're north of 70 plus percent of the population. That's why we're
Ooh.
seeing what we're seeing,
Mhm.
and we're not. What are we doing to change it besides admire our problem and talk about it?
Yeah,
Right? We've got to do the action, and it's got to be different, or else it's what the definition of insanity, doing the same thing over and over again, expecting a different result.
We can just throw more money at it. And
Yeah.
we can just house them with the same, with nothing to change but the same mental aptitude that's insanity out there, and then put them in a nicer place to live and
Right,
expecting them to have some kind of different result. I mean, with
right,
us in the recovery process, I'm very clear about if you keep on applying your old coping skills to your new life, it's going to fail. It's going to
correct.
fail.
Yep,
So we're looking at some new solid. If you were to just have slid over the DNA testing and then it's like, here's your biomarkers, here's
right,
how this scenario is going to come and pull together, and it's going to upgrade you epigenetically, and it's going
right,
to feather that volume up a little bit higher, and you're not going to be able to handle it without some situational, practical, applicable coping skills, and a
yep,
little bit, and most importantly, a group around you or people that are in this new community that's going on for Wired for Addiction or AANA or any self-help
yep,
platforms out there, to
yep,
have the communication in and the results going. Like when I don't even know why we don't just save our no, that's a whole different topic. But going in like on how Bruce Lipton will break down epigenetics, being a cellular biologist, talking
right,
about the stem cells. And then we put the stem cells. So how does the stem cell, could be any cell. So
right,
this putting the stem cell in its own culture, and or what would be the its own dish, petri dish, and then
yep,
whatever culture it is, then that stem cell adapts and becomes that. We see
right.
that is when a basic breakdown process for us is, what environment are we put in, and how would we adapt anyways?
Exactly the perfect analogy.
Yeah, it is just unbelievable what's going on. And I can't believe what's been happening that I wouldn't see in my life, that I would be sitting here talking to another doctor or having all these new age mentors and everybody screaming it from the rooftops with these platforms. And then coming in, this is the new age. I'm super excited that I could also come from my addiction history. Mike come from his addiction history. You spurred on from your ex-husband's addiction
Yep,
history, and then seeing that and spurred on and not wanting to happen to your daughter, and then just
right.
opening up the conversation of where we're at, and then hopefully unwinding this whole 2024 psychological drama that we find ourselves in, that almost
Yeah,
seems insurmountable on other areas, but seeing how we're coming in and doing this is just unbelievable.
yeah, yeah. Insurmountable is how some people would see it. And I think if we
Yes.
just keep whacking away, we can do it. I talk about the 4 pillars of health. It starts with our physical health. We've got to change our physiology. If we're optimal on our physiology of what our working system is, our emotional health operates better. If our emotional health operates better, our intellectual health
Mm,
operates better. And then lastly, to me, the best of all of it is our spiritual health is going to optimize and
amen.
be working as well as it can. But it all starts with that foundation of your unique physiology.
How beautiful is that? The Go ahead, Mike. Yeah.
So, Dr. Higgins, I would assume that your platform or your testing would be for substance abuse, but does it also help with process addictions?
Absolutely. Yes. Great question, Mike. Um, Process addictions really are no different in the physiology component. It's the whatever they find at whatever age they do that makes them, oh, that feels good. And now I've gotten my dopamine increased and I've, got my serotonin and all the other things. But process addiction really is no different, be it, gambling, porn, sex, shopping, the list goes on and on and on. No different whatsoever.
Yeah.
Great.
If you have to reach outside of yourself to get something to change the resting state of what's happening with you now, it's telling us like we're not optimal in our physiology.
Yeah.
And there's no shame in that. It's we isolate, we measure, we identify. There's no shame. Everybody's got something, but let's know what the starting point is for you.
Absolutely. We're all on the
Yes.
trauma spectrum at some degree.
Right.
Absolutely, right? The little T's and the big T's. We've all got them.
Yeah.
It's how they affect us. And I'm glad you brought that up, Brett, because there's so much conversation about trauma now.
Mhm.
Trauma is more than just a word to quantify a negative experience. It changes our physiology. And we have to understand that, because unless we say, where is our starting point? We're never going to get to where we need to go. We may get a little bit better here and there, but it changes our physiology. So, what is it? What are we working with without guessing or throwing a dart and hoping we land someplace close?
Oh my gosh, yeah, it's a breath of fresh air, true, because a lot of from where I am in a conversation with, practicing the 12 steps over a period of time in my life, to see my coping skills, which, have changed internally. This is an internally
Right,
12-step process going on,
right.
and then we drive it out. So internally going for the process and then reprogramming my subconscious and how I react and how I
Yep.
recoil and how my emotions and actions and thoughts and behaviors are and everything. It would been interesting to see where I was to do your biomarkers and then to see which ones were turned off now at this point too.
Right,
Is
right,
that something
exactly.
you can quantifiably, see on these, uh, markers?
So with the neuroscience, the neurotransmitters, the hormone parts, we'll see those change. We'll see different
Mm,
numbers. With the genetic SNP portion, those polymorphisms, where the errors are, we're going to see the same test. Is it heterozygous? Is it homozygous? One of them, two of them affected. We're going to see that same test, but we'll see the expression change. So obviously, both of you gentlemen sitting here having wonderful careers, having a podcast where you are in the thick of the conversation of what's happening within this part of health, your expression has changed.
yeah, absolutely. I know that, and,
Yeah,
it'd be still interesting to see where it's at. I know,
absolutely.
my
Yeah,
son, being raised as a child of 2 alcoholics and addicts, coming up into his 30s, has, vocally said about his process too, about how he needs extra help,
yeah,
and,
exactly.
he's seen so much change, but there's so much change going on, and, to see him vocally come to us and having that open conversation of where he's at, that he's kind of struggling and needs extra help. I see so many people doing the extra, therapy that's needed, whether
Right.
they are healthy or not. I mean, I hear a lot of like Howard Stern. I mean, he's so big proponent on therapy. And then all of the people that have kind of the extra money, it doesn't mean that even people don't have the access of therapy on the lower income levels. They do. But how
Right.
many people love the therapy and self help, even if everything is fine, to
Oh,
keep that
absolutely.
going too?
Absolutely. And we should, because we're all evolving, hopefully, all the time.
Yeah.
And we find ourselves in new situations in life. New situations can bring about new stressors in life. So it's not like a one and done, I'm good for the rest of my life. It's
Right.
you gotta keep on. Where am I at? Where am I at? And the beauty is that once you feel the difference, that's when people are like, haven't seen them for a couple of years and they come back, okay, I've got this, and this going on in my life. I know I'm not right now. Let's see what my physiology is looking like, because now you know the difference of what it feels like. I can't tell you the amount of times that when we're going over someone's lab report,
Mm,
there's tears, they're tears of joy,
mhm.
because all of a sudden it all makes sense, and it's validating for exactly the way that person felt and played out their lives.
Mm.
And to know it can change.
Absolutely, the power
Yep.
to but there's work involved. Sorry, guys. Sorry, listeners.
Always,
Oh, yeah, always. This isn't just
always.
like, "Okay, here's the information." I mean, it's like telling someone, giving them a diagnosis, and, "Here's your information, what you gonna do about it?" And it's like, "No, we can't keep drugging this information."
Right.
And it's like, you can use what they would call nutraceuticals and,
Yep.
so many different things, diet and exercise, being in self-help groups, definitely meditation off the chart with what's going on with prayer and across the fields. I mean, I'm a big Joe Dispenzian fan and what
Yep.
they're doing and, connecting. It's just unbelievable what's happening. And,
It really
do you have
is.
any other questions going on, Mike?
Just another one was regarding the tests that you do. It's not something that is trying to find a single DNA But
Very good,
it's a
Mike.
grouping, correct?
Right. So, we're trained because of how our healthcare system works to think that everything is a single molecule answer to a single molecule problem. Nothing
Mhm.
could be further than the truth. There are so many layers to mental health. There are so many layers to addiction. Like most things that any of the lifestyle diseases, same exact thing. So it's not one. That's why we look at 85 biomarkers because they all have layers to
Right.
what this aspect does to these, and they're all interrelated. And it is beautiful when we go over it with someone and or their family or their support system, because that's good too, to have other people hear and understand what's been going on with the individual. And all of a sudden someone, and I try to make things as simple as I can, not use, like, I'll say I'm going to get sciencey just for 1 second, hold on, don't drool on yourself, because people stop listening, right? So I try to make it as simple as possible, and it's difficult because this is some heavy duty science. But at the end, somebody that has no science background is like, wow, I get it. All of these things have to do with each other. Let me just use the word autophagy, science
Love
word,
it.
autophagy, right? So we've known about autophagy for a long time, but it was only in 2017, 2016, Japanese physician won the Nobel Prize for understanding the intercellular workings of autophagy. What's
Mm,
autophagy? Garbage man of the cells.
that's right.
If the garbage isn't being taken out, what happens inside of us? What does that debris do to the
Mhm.
other cells,
Mhm.
right? And then we get to the meat of it, and we're looking at things like the COMT gene, catecholamine methyltransferase, those excitatory guys, that dopamine, that epinephrine, that norepinephrine. If we have a problem there, we can't reverse and get out of that feeling of anxiety or depression. Let's just take those two things. We look at 85, but let's just take those two. COMT gene, we have a homozygous or a heterozygous, meaning one or both genes are affected. We've got that autophagy going on. How is that going to compound what's happening with us? Not going to work clearly, right? So all of these things build on each other.
Yeah, so the autophagy basically to clean out, it's like all these biohacks that have been put in the
Yeah,
biology that we have. How why wouldn't we want to know it? I mean, this is a
right.
great analogy for video game people. It's like give me the hack code so I can get in and win this game of life kind of thing. And it's like here we are, here it is. Autophagy, you can go into high states of fasting and then your body goes boom into these states of fasting. And I've been going into it myself, and I can't believe how great I felt. I did a 96-hour fast, and then my next one, of course, would be another 24-hour on that, and I was feeling great as I started
Exactly.
off from 12 to 24, and then
Right.
going on into 48, and then keep on going, and then at 96, I tapped out, and I'm like, I should probably get some kind of bone broth, and where I was
Yep.
feeling, and a lot of my other friends and people too are doing it. And I
Yep.
can't
Yep.
believe how much energy and how clear focused I was. And they
Correct.
say, right, that I didn't know about this Nobel Peace Prize guy winning this was
Yep.
unbelievable.
Yep.
And to get, they say, at 1 week of autophagy, that your chances of getting cancer are decreased like what, up to 80%? Were they
Yeah,
saying?
yeah. And that's one of the things
What?
that yeah, exactly. That's one of the things that we would look at in someone's lifestyle picture of their particular genetics. Is it 12 to 15 hours of a fasting for you? Is it more than that? Is it 16? What's going to be best for your DNA? But just like you said, Brett, when you get to that point, now you, they're going in. It's like the old Pac-Man game, right? You used to, put your money in the machine, sit there and play Pac-Man for as long as till you got kicked off. But that's what those cells are doing. They're going around and saying, "Oh, you don't belong here. Get out. You don't belong here. Get out." And what that does, not even from um, the weight perspective of things, but from the cognitive improvement, from the clarity,
Mm,
from the energy, right?
absolutely. How much it takes the body to just digest these giant boluses of calories that we put into us. And
Right,
then once
right.
it stops that area, then the body's like, "Oh, cool. I don't need to worry about doing all this other energy. Go into this biohack mode, doo doo doo." And it's like, let's start clearing out the system.
Right. Like we would look at some mitochondria genes, right? The mitochondria, where our body makes the energy.
Yes.
If we're having trouble metabolizing and we have errors in the coding of some of these mitochondria SNPs, then our energy is being sucked out of us. And then we're trying to eat more often than our body really needs to. That creates such an energy drain. I mean, all of these layers together give us the picture.
Wow. It's just it's just awesome. What about you on Solomon? You have any insight or maybe some questions on this in the background over there?
Um, I'm just sort of listening along. I guess the question I would have, and sorry, doctor, you can't see me here because I'm sort of on the
That's
other
okay.
side. Um, is there like once you determine that these factors exist, is there like a 0 to 10 scale? Like this person is, you know, slightly more, addicted, or a lot, or is there a scale to that? And can
Sure.
you determine it?
Yeah, so we would be, I wouldn't call it a scale, but we would be identifying as we go over each one of these 85 biomarkers, identifying this is a problematic area for you, this is a problematic area for you. And then, where does people often say, like, so where do I fit into the other people that you've seen? How bad am I? Right?
Right.
Right.
Yeah,
Here
yeah.
we
People
go.
will ask, like,
Right.
yeah.
Okay.
Um,
And then do you further take it another step and maybe say, okay, because I like my brother recently passed away. He was addicted to crystal meth for a long time. And one of the things I noticed about him, and I noticed a lot of people like uber creative people,
yeah,
have a tendency to be more susceptible to addiction, at least from my, subjective point of view. Does your research sort of look into that and look at other markers in their life or personality that sort of also help sort of determine some of those possibilities?
sure. That's kind of
Great question.
we have a really extensive intake. It's 12 pages long because
Yeah.
we want to know
Mm.
everything about you that brings you to this point, everything that you've already tried to do. And we do get pictures on people. And you're right, Solomon, a lot of creative people, the gift of creativity can also come along with how do you balance all of that in the world that we're living in. And for a lot of creative people, that can be difficult
Right.
because they see the world as a beautiful place where everybody doesn't necessarily see it. And that challenge to live within that world can be difficult. I mean, sometimes I say to people, be of this world, not in it,
Mm.
right? There's a lot of days where I'm not in it, I'm of it, I'm doing my thing, but I don't want to spin what's going on here.
Right.
And we have to understand that to be able to remove ourselves and always for self-preservation.
Yeah. Well, thank you.
You're welcome. You're welcome. I'm very sorry about your brother.
Appreciate it.
Yeah, condolences to all our brothers and sisters out there going down with a lack of information or a lack of inspiration or haven't that got caught is what I call our society the addiction creation machine.
Yep. Agreed.
So I mean,
Agreed.
we got to not be blaming ourselves being swallowed up by the mass
Yep.
confusion that's put out because in my opinion, if everything they wanted us healthy on the higher level of those kind of things, we would be super healthy. A lot of
Okay.
people are more interested in the illness than the wellness, and here we are spreading it
Yep.
from one person to another.
You're
Most
right.
definitely, and really appreciate the breath of fresh air. And that was a great question, Solomon. As what we would come from an objective point of view or subjective, it doesn't matter. So, I mean, what is the overall compilation of data on the back end over at Wired for Health Addiction?
Oh, the
It's got to
what
be
we are
vast.
it is, and what we are compiling is truly changing how the industry sees things, how healthcare sees things, and to include this into healthcare. When I tell you that the largest insurance carrier came to us,
Wow.
that's unbelievable. They don't go out looking. They came to us to say, we want to do a large pilot because we
Oh.
know the efficacy of what you're talking about is there.
Mhm.
They came to us. What does that tell you?
That's amazing.
Yeah, that it's time that we start treating this like it's healthcare because we're not going in the right direction. And really, insurance companies care about bottom line dollars and cents and really nothing more, right? So if they see, okay, we're actually going to save some money if we can cut
Hmm.
this off at the pass earlier in the game, we're going to benefit,
Absolutely.
right? It makes sense.
It makes 100% sense, and, that is a breath of fresh air. I've worked with a lot of
Yeah.
insurance companies, making calls and doing things on the back end of utilization review, and,
Yep.
the fights that exist between mental health and the process of them paying. I mean, how much more better would it be for them and conducive that we think on the front line,
Right.
it's like, let's get proactive instead of reactive. Let's get kind of Kaiser-ish on their commercial, like, program and stuff like the ounce of
Yep.
prevention is better than a pound of cure going on. Let's just
Yep.
get it going from the very beginning and
Yep.
apply. And then that's going to be, hey, you know, you can even increase the insurance premium a little bit. Probably won't see much of that. You know, you throw that in for an extra buck, you know, over a whole lifetime of process. And then you have this extra information coming through. And then here it is applicable. And then you can meet with the Wired for Health. I mean, wow, to be on
Yeah.
the
Yeah.
nexus and the cutting edge of this one, it must be super exciting to have that call come through.
It is. It really is. And at the end of it, it's not just going to make that individual's life better. It's going to make everyone in the sphere of their life better, and then society as a whole.
Oh yeah.
You know, isn't that what we're supposed to be doing?
Mhm. Yeah. That's what we're supposed to be doing. I mean, we get to see the transformative process in the group program,
Sure.
the addiction survivors group, as I like to call it, self-help program of AA and NA. I mean, we just
Yeah.
came from a big book study, and then we get to see people in the treatment modality process or recovery centers. People get better so fast
Yeah.
and so much better. And then to
Yeah.
have so many people right now across all these platforms, and especially on the social media aspect and what you're doing on, I mean, you'll talk with anybody. I can only imagine you standing on a street corner and someone do say a buzzword, and it's like, even if glad for you to ask or not ask, and here's what I'm doing, and it's going through,
Yeah.
and then to even put in what they did with the ACEs test and
Right.
how that is, then do you guys incorporate any of that other
Yeah.
collateral stuff with you guys too, and or what's been going on
Yeah. Sure,
with
we do. Because that affects everything, right? So, well, so I mean, our brain's not fully formed until our mid 20s. So,
oof,
if in our childhood we have an environment that is very difficult and problematic at best, that's going to change our physiology. What
yes.
may look like, let's say, ADD or ADHD, is really anxiety that was wired from when that child was 3 years old on,
Mhm.
right? So, looks like should be eliminated from the vocabulary. We should know because then we're going to have a more effective treatment if we know what we're dealing with to begin with.
It's so powerful. Have you ever been in contact with Nadine Burke or any of those
No,
other people that do that? Oh, okay, that's
no.
interesting. I would like to have her on the podcast at some time. They had our whole
Yeah.
hospital do the ACEs test
Oh,
where I
that's
work. It
great.
was super you know, on a scale of 1 to 10, there you go, and it's like the
Yeah.
social determinants that come out of that one, we're going
Right.
into the well. We're not just throwing a
Right.
Tylenol or a ibuprofen on this one. This is the
Right.
absolute biological well that we're talking about right here,
You
and I
got
can
it.
see the smile every time on your face when it comes in through this, and it gives me chills talking about it,
Yeah.
and, it's super powerful. So let's talk a little bit about, how was this cruise of yours that you
Ah,
just came from? I mean, I got to follow on the sidelines a little bit on social media. I mean, how amazing was that and how receptive? I mean, we're coming down
so
on towards the end of the podcast here, but let's just talk a little bit about that.
yeah. So I've just come off an amazing 5 weeks.
Woo.
Um, flew to Singapore, went Singapore through a couple places in Malaysia to Thailand to Sri Lanka to Mauritius, Africa, back to
Wow.
the States for 2 days, then to New York, Bermuda, Azores, Portugal, 4 cities in Spain, then flew to Denver to speak at an adoption conference, people that could really
Wow.
use this information, right?
Mhm.
So the reception over 5 weeks was nothing short of powerful, because people are so hungry
Oh yeah.
for, okay, we've talked about all the problems, but what can we do to change them?
Absolutely. And they just came out of nowhere and hit you up on this cruise thing to do these talks.
Yeah,
And
yeah, they came up, yeah, like, would you be willing to do this, and told me the places, and I'm like, of course I would.
then we'll give you a stateroom and everything too. And
Yeah,
here you go,
yeah,
free cruise, right?
yeah,
And all that. How do you turn that
yeah,
one down? How
yeah,
beautiful is
yeah.
that? And how was the reception though? Was the
It
audience
was
pretty good?
beautiful. Yeah, when you have audiences of people that really are curious and
And right in the
want,
middle of their vacation, right?
yeah, in the middle of their
Oh,
vacation, curious
beautiful.
people, adventurous people, like, whoa, you're talking to the crowd that's like, I hear you, I hear you. And regardless if it's them, it's somebody in their world, if not
Absolutely.
several people in their world. And one by one, people start coming up to me. Can we grab a coffee? Can we have dinner? Can we have lunch? This is what's going on. And it's everybody. It's
Mhm.
everybody.
You can't
And
be
it's
alive on the planet these days without being on the trauma spectrum. And then
no
the
way.
amount of what I also like to call our society, the fear factory,
Yeah.
and what's going on and how much is just pushed across. And then it's almost hard for me to watch TV
Yeah.
these days with every other one's a pharmacy plug and
Yeah.
some
Yeah.
song and dance with it, and it's like I see a lot of these other things going on and being in the medical field about how much we're collateral issues or lawsuits have been pushed across on a lot of these different medicines, and then they just break down the different signs and symptoms of it, and it's like, "Urgh." It's like,
Yeah.
whoa, I'll stick with the primary problem. I don't want all these collateral situations going on. And it's like,
Exactly. There's not, I'm not anti-pharmaceutical, but what I
no,
am
we're
anti
not.
is using that. Yeah, of course, you wouldn't be doing what you do. But what I am against is not figuring out the why behind it and just saying to somebody, here, take this and let's see if it works.
Exactly.
You know?
Yes, definitely the platform of what you're talking about. It's like, let's
Right.
get into it. We have the information to apply. Here's ABC, here's X, Y, and Z. And this is a proven process. And the process on the back end of yours, the information being pulled together, the compilation of the data across all the processes. This is a golden age we're moving into, it sounds
Yeah,
like.
yeah. It's beautiful. It really is. Change people's lives, and like I said, that's what we're supposed to be about.
Absolutely. What a breath of fresh air. And how, let's ask another question on the medical side of it. Um, when you first started finding out about this, how relieved were you that you were going to be going into a different area of taking the Hippocratic Oath and then being able to apply? And how many people were resistive on your other end about going to this new paradigm shift in treatment?
So initially, some people were kind of like, "Are you sure?" That all that skepticism, and
And
then
even
as
yourself
more,
too, right?
yeah, am I crazy? Maybe I asked myself that once or twice. But but as more and more data came around, and I just saw the results of what we were doing, it's an, oh my god, like, this, everybody needs to know it exists. You can pass or play, but everybody needs to know it exists.
Absolutely, absolutely. So what are some of the statistics on the background? You've been doing the biomarker test, you said, for how many years now through your platform?
As a company for 3 years, in R&D for almost 17.
Okay. So it took that 14 years or so of R&D to come up with the platform. What an arduous process in the background that you've had your finger on the pulse with, right?
Yeah, and then to look at the SNP portion of things, those single nucleotide polymorphisms, that genetic SNP part, that technology, machines, if you will, were only like 2014,
Mm,
2015 that
wow.
came about. And that was like the, whoa, okay, we add
Let's
this piece to
go.
it, boom, let's run, right? And then COVID happened. Everybody's conversations were on that. Yeah. Yeah, the screeching brakes. And now we're back to, let's look at what's going on. Ooh, this isn't good. Kind of like what we were saying, of 53% of the population, anxiety, depression, diagnosed. So now we have everything we need in the technology part to actually make the changes. It's a perfect time.
Wow, what a crescendo right there. Any other questions, Solomon or
I
Mike,
have
before we
one
wrap it up?
last question on my
Absolutely.
end. Doctor, do you think the emergence of services like 23andMe have made the public maybe more open to the idea of having these types of tests? Do you think that sort of opened the door to that?
Yes, I do. It became dinner conversation for people.
Right.
So that makes people think differently. Their minds open to, hey, where else could we look at these kind of things? What else could we learn from this? I definitely think it did. I think where it wound up is a little problematic, but I think it opened the conversations, which is what we needed to happen. 10 years ago, somebody wouldn't receive this information the way they do now.
Right.
So it was a good thing, a really good thing.
Wow, to open up the minds on the human genome and what's going on.
Oh my
It's like
gosh.
for people like us. I mean, I'm always been into science and what's going on and how the things work, and then became a medical professional, and then really took a deeper dive on the whole 50 to 70 trillion cells that make the
Yep,
community, and the electron transport chain, and how ATP is
yep,
produced, and all those kind of things that you learn in microbiology and
yep.
physiology and all these processes. And of course, you being a doctor on the other end on a deeper dive and putting together what medications go with it. And then how perfect is it for you to just take a step to the left or the right, or do a little bit of a dance that way, because your square foundation is so powerful that you could just see the application of with that, and then being able to diagnose and prescribe in
Yeah,
this process, and then to put it together. And it's like, no, it wasn't this diagnosis, but it was more blanketed. But now we can move through that. And we see
right,
that really applicable into recovery, with a lot of people coming in and have been medicated for a long time over these processes. And then the process of going through it. And then after a period of sobriety, that they're able to titrate off of a lot of the medications and then become
right,
happy, healthy, and whole.
right. I know probably want to wrap it up, but just to add one more point to that,
Yeah, of
you
course.
know, Mike, you raised your hand on being medicated for so long. I
Yes.
can't tell you the amount of times somebody comes in and has been on an SSRI for decades. First off, they were
Mhm.
never meant for chronic use. They were meant for acute, short-term
Mm.
situations, right?
Ooh.
People living on them for decades. And first thing is like your serotonin is in the tank. So this SSRI really was not effective for you. So your kidneys, your bladder, your your liver, all of these organs that have had to process this out, a little bit of stress on that. But
Yes.
beyond that, there's a particular gene that we look at to tell us whether an SSRI is even going to be effective for an individual. So no one ever did that. So what does that do to somebody? You've been in on an SSRI for decades and it's still the doctor's like, no, you should be feeling this way. Doc, I'm not. Well, then you should be feeling this way. I'm not. What does that do to you emotionally? Is this just me wanting to be this way? Right? You start to self doubt who you are and what you're feeling. So there's
Ooh.
so many layers to this.
Wow. How convoluted and confusing can that be on the recipient side?
I will
Absolutely.
definitely be talking to my psychiatrist about
Well,
this.
maybe we can get you a little discount through the Super Sober podcast on the Wired for Addiction process and come up into your doctor with some new information, huh?
That's right.
Yeah,
So
yeah.
I know that I'll be plugging with that if you're okay. We're coming down towards the end,
Sure.
Mrs. Heaven, me, Miss Evelyn Higgins, and so like definitely wanted to do some shout outs to your platform on Wired for Addiction, right?
Yep.
.com. It's easy to go on there. We've already did some slides up there on that, and the process of payment and going through it, it's really easy. I've clicked through her website before, and they have it really super and simple. And you also can do like a free 15-minute consult with people that call in.
Yep. Yep.
Can you
Yep.
just
And
take us
see,
through like a quick minute process of how someone can easily just go from zero to getting
sure.
someone on the line?
Sure. So we literally work with people from all over the world. We drop ship the lab kits to you, make it really simple, done
What?
at home. But if this is even a thought, you're listening to the podcast and saying, this is for me, this is for a loved one, you can make a 15-minute complimentary consultation. Give us background. What's been going on? What have you done so far? Where are you at? Is this going to be beneficial? Yes, no, how? And what that process would look like. It's so simple. I mean, everything is laid out. There's no get you on the phone because there's a sales pitch and we're not going to tell you anything, right? This is to help. This is to help people. And
Absolutely.
it's that simple. We get your date of birth, we get your physical mailing address, we order the labs, we start the process, and life starts to change.
Wow. How simple is that? That sounds almost too simple.
It really, I can't take anything else out of this. Just if it resonates with you and it's something you need to do or share with your loved one, we've made it as simple as we possibly can.
Thank you so much for coming on the podcast.
Yes.
So I'm going to definitely maybe lock you in for future podcasts. That would be awesome.
Sure,
And
I'd love
definitely follow up where we're at and how you're on growing with your platform and all
Beautiful.
of that. We got a community building here of medical professionals and everybody from KDAX to just people in addiction treatment and how they've changed their life. We're going to do a shout out to the Super Sober podcast. We now have a sponsor now, and that's His House New Creation. You're going to see that commercial on this episode. We have now got a ongoing process. We couldn't be happier more with the changes on the website. It's easier. It's upgraded there. We're doing all types of things. We're going to be just keep on moving forward. You can email us at info@supersoberpodcast.org or info@f3recovery.org. Shout out to our first mascot of recovery, Notorious JID, sitting right here, jails, institutions, and death. The 3 outcomes of active addiction. If you don't start applying some of these things or doing something different in your life, we already know the road that you're on. So the healing is here. The communication will continue. Shout out again to Solomon here at the podcast place, being the awesome producer at Long Beach, California. And we'll be shouting it out and keep on keeping on.
Thank you for listening to the Super Sober Podcast. Go to our website at f3recovery.org. That's F3Recovery, all one word, .org. We're turning fight, flight, and freeze into free form and flow through practicing the 12 steps and staying accountable to change. Don't forget to keep on keeping on.